Hello all. My name is Stacey Mankoff. I'm the managing principal of the Mankoff Company and founder of After the Bell events. And I'd like to welcome you all to our latest Bellringer, which is on blockchain in the healthcare sector. What's new and what's next? And I'm delighted to welcome Jonny Fry as our speaker. Jonny is the co-founder and CEO of TeamBlockchain Limited, and he is a blockchain digital assets and funds specialist. Prior to this, Jonny founded Premier Asset Management, and currently he focuses on the dynamics of financial innovation, where he advises organizations on how blockchain and digital assets can be applied commercially. Jonny also produces a research analysis of these developments in a weekly report called Digital Bytes, which I encourage you all to subscribe to. And it's also a basis of a show on blockchain radio. He is the non-executive chairman of Gemini Investment Management Limited and the co-founder of the British Blockchain Frontier Technology Association. And again, welcome, Jonny.
Thank you very much. Delighted to be on the show.
Terrific. Now, let's sort of get started with where are we currently when it comes to blockchain applications in the healthcare and pharma sector?
Okay, so there's been a lot of discussion and a lot of focus initially looking at blockchain technology in the financial services sector. But as people realize that probably one of the greatest attributes of blockchain technology is the ability to create greater transparency and therefore greater trust. And arguably, probably the most important use of blockchain technology is being able to have confidence and trust in terms of the medication that you receive, because you want to make sure that you actually are receiving something that'll cure a disease, as opposed to perhaps just a tablet that maybe is being pressed out of chalk. So blockchain technology is being increasingly used in the healthcare sector in all sorts of different ways. But probably, if I may, I'd like to start with a quote from Deloitte, who, in theory, being one of the larger and more respected consulting companies, they came out with a quote recently, which I think kind of sums up sort of the sector and the use of the technology. And they said, blockchain technology has the potential to transform the healthcare sector, placing the patient right at the center of the healthcare ecosystem. And increasingly, the security and privacy and interoperability of data is paramount. And the technology can provide a new model for health information, making electronic medical records more efficient, disintermediated, and secure. Whilst not a panacea, the new rapidly evolving field provides fertile ground for experimentation, investment, proof of concept. Wow, what an optimistic sort of quote. But what's the reality? Is blockchain just another buzzword, or is it a technology that really can sort of transform the sector as a whole?
Yeah, I mean, especially about healthcare records, because we all go to doctors, and also with the ever-aging population that we have here in the US and obviously in the UK and globally, we're going to be going more and more, using more and more of the medical profession. And every time, if you don't go to a doctor that's in a system, you have to fill out all these forms. So with the blockchain technology utilizing with medical records and forms, be more secure than what we have right now.
Yeah, so a good example would be Coral Healthcare, based in Canada, and they're using blockchain technology along with smart contracts. And basically what they're trying to do is improve the efficiency of the healthcare system.
I'm going to stop you for a moment. When you're talking about smart contracts, not everybody who is watching this is familiar with that term. Could you please, briefly, just explain what a smart contract is as different from a regular contract?
Sure. Well, think of lawyers like to say they're not smart and they're not contracts. But in the UK, they are now recognised, certainly by the High Chancellor, who in theory is the chief sort of legal in the UK, as being enforceable. But what they are, I would suggest you think of them more of a flow chart. If this happens, that happens. If that happens, then that happens. And it's a way of programming a computer to say, if Jonny is over 18, then he's allowed to go and takes certain medication. If he's under 18, then maybe he needs a guardian or a parent to be with him for a medical examination, or maybe they need to give consent before you can go ahead with the procedure. So this is a way of taking structured data and then providing a degree of automation on that data that then can apply certain things. So again, in the healthcare sector, Jonny needs a repeat prescription. There are certain things that perhaps you need to make sure that's happened. So perhaps I needed to have my blood pressure taken, or maybe I need to have my temperature taken, or maybe I needed to have sign off from my physician. If all three of those are in place, then an automatic prescription could be issued. So that's where smart contracts. So what we're trying to do is to create an auditable track record so people can see how and why were certain procedures carried out or medication given. So we've got checks and balances that are automatically built in, rather than worrying and relying on the paper-based systems. And this is particularly important when you're looking at multidisciplinary healthcare systems. So you might have a situation, albeit extreme, if you had a minor, i.e. a child with maybe mental and physical challenges. You've then got to actually involve all sorts of different agencies and physicians and family members in order to make sure that the interests of that child are protected. And I was talking to a lady recently, and she was explaining to me that actually when it comes to pediatric care, particularly in the cancer field, you could in the UK have up to 30 different medical healthcare professionals all having some interaction with the ongoing care of a minor like that. So what blockchain, what smart contracts can do is say, well, okay, we've checked and made sure certain things are in place, and then the professionals can get in and actually look after the actual patient, whether it be the doctor, the scientist, the lab technicians, the nurse, maybe the public health authorities. So they all have access to one database, as opposed to lots and lots of different information, which might be on faxes or laptops or bits of paper or in a filing cabinet.
Right. Well, that makes great sense. You were talking about the Coral.
Yeah, so Coral Healthcare is a company based in Canada that's actually doing that. You've got another company called Medical Chain. They're based here in the UK, and they're using, again, blockchain-powered platform to securely hold patients' records. So again, it might be the doctor, it might be the hospital, it might be the medical labs that can request information. And I think this is the other interesting thing, is that typically we in the past just handed over our data, and we don't really know who's got access to our data and how long it's there. But what you can do using blockchain technology is that you can have control of your data, and you can say, I will let you have access to my data. And now I think we need to start increasingly thinking about the pandemic of COVID. So I may, and I think we're going to see this increasingly. We're talking about here in the UK. I need to be able to prove that I have had 2 vaccinations. And I would suggest in 6 months' time, I need to prove I've had 2 vaccinations and I've had a booster, or I've had some other health screen. And if I can prove that, I'm allowed then into, America, or I'm allowed, to actually go to the theatre. So this is a minor part of your healthcare information, but I don't need to tell you where I live, my date of birth, my ailments, but I just want to give you a very thin slice about my health situation, so you can actually see, and then you can allow me into a crowded nightclub, theatre, or maybe on an aeroplane. So this idea of healthcare and passports, we're already seeing an application with the International Chamber of Commerce and a massive repatriation company called SOS, which any of the listeners and viewers today, they may well find that their company has an SOS policy. So if they have sickness or injury, perhaps they're skiing somewhere or a water sport, they'll be repatriated back to the home using SOS. And so SOS have teamed up with the International Chamber of Commerce in effectively issuing passports. And this has been implemented now in Catalan, in Girona. So you can now say, okay, well, I can go into a restaurant, I can go to a football stadium. Sorry, you call it soccer.
It's all right, yeah.
I know we're going to go through cilantro and coriander and tomato and tomato, but there you go.
I think they wrote a song about that. Yes.
So real practical examples of how, and this International Chamber of Commerce and the SOS is an example of a blockchain cloud platform that the Catalan Blockchain Institute have actually been pioneering within their country.
Now, are these more secure? I mean, I live in New York City, and in New York State, they've implemented the Empire Pass. So basically, I've uploaded my information, I think it's partial Social Security, the dates of my vaccinations and all of that. So I can use this, and it becomes a QR code. So I can go to certain venues and all, theater and concerts and sporting events, and I just show that. I don't think they're using the blockchain, but is the blockchain application on these things make it more secure than what this app is right now?
Yeah. Okay. So I think this is one thing. It's a really good point you brought up. The blockchain technology is well, firstly, it's not new. The first main wide-scale adoption was Napster. So anyone sharing music. So it's been around since the 70s as a technology.
Mm-hmm.
But secondly, it's not a silver bullet. You don't need to use blockchain technology when a SQL Server database is quite capable and competent of doing it.
Mm-hmm.
And I would suggest that a way to think about blockchain technology is an Excel spreadsheet on steroids. It basically holds the information, but it holds it in a very, very secure manner. And I think one of the most important things is that, and I mentioned that word structured data earlier on, and what it does, it holds that information in a very structured way that then can be interrogated, maybe using smart contracts, or maybe using artificial intelligence or big data, machine learning. And so we like to look at blockchain as almost like a skeleton. And from that, some of these other technologies can hang from. But if you've got a very simple, straightforward, can you access, have I had a COVID vaccination and it's just in New York, and there's absolutely no reason why you necessarily need to have a blockchain powered platform to do that. Okay. So we shouldn't get too hung up about the technology per se, but it does undoubtedly have some really sort of quite interesting use cases. And a good example of that would be, if you look at, again, another Canadian firm called Bloodflow.
Yes, I was just going to ask you about that one, because we wanted to talk about some of the cutting edge developments that are going on.
Yeah, so this is a startup, and many of you will have friends and family that have certainly received blood if they've been involved in an operation or have given blood. And in the UK, if you give a unit of blood, they give you a cup of tea. Probably in America they give you a Coke or something like that, but over here you
a sugar cookie. You get a sugar cookie.
Sugar cookie. Oh, that's good.
And,
that's
and orange juice. Yes.
Should be a banana and orange, but yes, a sugar cookie. So we're given a cup of tea, and the blood donation agency, which is kind of a government-run sort of thing, sells that 1 unit of blood for £146, £145, 22 pence. So to put that into dollars and cents, it's around about $220, $230. Right. In America, if you go and give blood, then the agency, again, it's like a government-run type thing. They then sell that to pharmaceutical companies and healthcare companies for between $200 and $300 per unit. Now, the reason I mention these numbers is that typically the number of people that do not turn up for their blood appointments to give blood is around about 15 to 20%. And most blood donation agencies, and there's 36 of them in the world, are desperate for more blood. We then have the added complication of plasma. And people are realizing that the use of plasma, which is an extract out of blood, can actually be injected into joints to help recovery. It's being used more and more for research. And something like 75% of all of the world's plasma comes from good old Uncle Sam. So you're exporting lots and lots of plasma all over the world. And Stacey, with respect, you're not under 30. If I can let the cat out the bag. And if your phone rings, the chances are, I suspect you would pick it up and say, "Hello, Stacey, how can I help you?" If you phoned my son or my daughter who are in the late 20s, they never pick up the phone. So the way these blood donation agencies work is that they have teams of people making phone calls, say, "Will you give blood? Don't forget, tomorrow's your blood appointment. This afternoon is your blood appointment." So they've got lots and lots. It's all very manual, very telephone based. Right. Well, for the younger generation coming through, that's a waste of time because they won't interact with the phone. So what Bloodflow is going to do is using a blockchain platform whereby all the appointments will be done digitally. So we can do pretty much away with all the teams of telephone people. And then they're going to use gamification. They're going to give you tokens. They're going to almost like play a game with you. Get so many tokens to make the appointment, so many turn up to appointments, so many to give blood, so many to refer people. And what you can then do is you then get companies, like Microsoft, and they say, okay, we'll give you £50,000 or dollars worth of tokens. And if you turn up as a Microsoft employee, you will then get $20 worth of tokens to go and spend as you wish. And that way, Microsoft say, well, part of our ESG commitment and doing something for society is we've put £50,000 into this program to guarantee that people are giving blood. And what they're trying to do is encourage more people to give blood. And one of the other incentives, they say, well, Johnny, you gave a unit of blood, and actually it went to help a lady who had a knee operation, or a little boy that had fallen out of a tree. So I don't need to know the lady's name. I don't need to know the little boy's name. But if I say, oh, my unit of blood helped in a certain way, then it encourages people to come back and give more blood. So It's a combination of using blockchain technology and tokenomics to actually encourage and nudge different behaviors, which are really good for society as a whole.
Mm-hmm. No, it's terrific. Let's take a long-term look. Where do you see opportunities for blockchain in healthcare pharma over the next 3 years, 5 years, and beyond?
Okay, well, undoubtedly, as with any technology, there's challenges that need to be met when using a new technology, and there's a natural reluctance to accept the change, and often there's a financial cost. So I think we're going to have to, I think in reality, because the healthcare profession is whilst at one level it has cutting breakthroughs, and that the fantastic results that the technicians have done with finding a vaccination for COVID is a very good example of how things can be moved very quickly. But the reality is a lot of what happens in the medical industry moves very, very slowly, because at the end of the day, you're potentially playing with people's lives. But I come back to this point about transparency. If you're in the UAE, United Arab Emirates, and you want to go and have an operation, then you can now go on through a blockchain platform and you can see who's the surgeon, who's the anaesthetist, the hospital track record, the nurses. So you can actually have all that information. So actually hospital A seems to have a better diagnosis or outcome than hospital B. So it's giving the patients a little bit more choice and giving them more information. That's at the patient level. At a pharmaceutical level, unfortunately, there's massive amount of fraud when it comes to the supply chain of drugs. And there's massive amount of pharmaceutical companies spending millions on developing drugs, only to find that actually, the wrong sort of mixture is actually made, and by another company, a competitor, are being passed off. And so therefore having a much greater certainty over supply chains. So I think at a corporate level, we're going to see more and more companies using the technology, because it'll improve their compliance, but cut their costs, because it'll give greater transparency. And then at a patient level, we're also going to see them saying, look, this is the information I want. I want information about my physician. I want information about the efficacy of the drug you're talking about. Because let's be honest, as soon as you've got some medical issue, many people, first thing they do is get on to good old Ask Mr. Google and say, what's the diagnosis? And you end up going to see, and again, I apologize, I've done this certainly for my mother, she had a medical condition. The first thing my sisters and I did was get onto the internet, and we immediately became experts and started grilling the consultant. Well, what about this? And what about that? And that's a real challenge for physicians. But that information is, I think, going to be increasing demand at a patient level.
Mm-hmm. Well, Jonny, thank you so much. You really gave us a taste of this. I encourage everybody to sign up for your weekly newsletter. And also, if you have any further questions for him, we have a way for you to ask them. Just send us an email. Be happy to connect you. So Jonny, thank you so much. Thank you all for listening. And I look forward to seeing you at our next Bellringer. Be well. Bye-bye.
Thank you.